Um, Aiden, you were diagnosed at the age of 53
Yeah.
with prostate cancer,
Yeah.
right? How long ago was this?
That was 9 years ago in November.
9
Just
years.
over 9 years. Yeah.
Okay. How did you come by getting your diagnosis?
So they use hollow needles to do that. So like there's 12 hollow needles to pull out bits of tissue.
9 years ago today, in 2015, my wife and I sat in front of my urologist and heard, "I'm sorry to tell you that you have prostate cancer."
Hayden is diagnosed with incurable prostate cancer. He has pledged to help as many men that he possibly can. Hayden had since then set up 2 support groups to help men who has been diagnosed with prostate cancer, Solihull and Living Well online group. He has been advocating with members of parliament to set up regular screening to catch the disease early.
So what are the side effects that come with the treatment for prostate removal?
So some men may have sexual dysfunction because the nerves that are telling you to have an erection are damaged during the surgery.
Okay.
And that may be short-lived and that may come back. But there are lots of things that can be done about that.
Like what?
Like
My name is Brian, and I have a dream to create a non-profit organization through my podcast to help spread cancer awareness and other illnesses that's affecting the world at large, and to financially support those who are diagnosed with cancer. My mom died of breast cancer last year, and I've set a target to hit my 1,000 subscriber by her death anniversary in March next year. You can help me to achieve that. I've noticed that 73% of you who have revisited this channel have not yet subscribed. Please, your subscription means a lot to the growth of this channel. And my promise to you is that this channel will get better and better and better. And it will help to scale the guests that I have on this podcast. Above me, there's a QR code that will take you straight to my YouTube channel to save you all the hustle. Now, do we have a deal? Thank you.
There could be around 208,000 deaths of all cancer combined every year in the UK by 2023 to 2040. That is around 569 per day, if my calculation is correct. With prostate cancer making the top 5 list, being third place, it is said that 1 in 8 men will get prostate cancer in their lifetime, and 1 in 4 black men. Stick around, we will be exploring another life story with our guest that has been affected by prostate cancer. He will share his journey with us. And remember, not every person will have the same experience. I'm not sure he will come with some good news around prostate cancer. I know you could get help, so stick around. Welcome to the Ivy Cancer Podcast, where we discuss cancer, health, lifestyle, and healing. And today it is no different. Aiden, welcome to this podcast.
Thank you for having me, Brian.
It's a pleasure to have you here with us on this podcast. I tend to surround my podcast with God in the midst.
Mm-hmm.
My mom was a prayerful woman, so I like to start my podcast with a word of prayer.
Yeah.
I would give my guests the honor. If not, I will go ahead and pray, if you don't mind praying.
Please do.
Okay.
Please.
All right, so let's pray. All righteous and eternal Father, as we come again, yet another podcast to discuss about prostate cancer. Many men has been affected by prostate cancer, and so we are here to help spread awareness and to gain some knowledge as well. We ask that you may bless our guest as he comes tonight to share his story. Bless the audience who will be watching, and forgive us all of our sins. In your name, I pray. Amen.
Amen.
So, Aiden, we're in the same men's mental health group.
Yeah.
And there was an article that was published by the paper.
Yeah.
And it was your story. And I read through the story, and it was interesting to me.
Mm-hmm.
And I was like, I would love to get the opportunity to interview this man, because he have a lot of knowledge and experience, and given the fact that you yourself been diagnosed. And I saw you again at a next seminar where we attend the men's mental health, and we discussed further about it, and you were willing to give us this interview, and I am really appreciative of it, because it's not many men like to be open about certain things, especially prostate cancer, surrounding the stigma and the myth and all of these jazz. And you are willing because, you know, you are an advocate and you wouldn't want nobody to go through what you have experienced, and you have been willing, and I appreciate that. So how are you doing?
Okay, so far so good.
How was your holiday?
Great, yeah. Went down to see my daughter down in Woolwich in London. We had Christmas with her.
Okay.
First time for her to have Christmas with in her own flat. So,
Really?
Yeah, so that was exciting.
Okay, that's good.
Good, man.
Milestone.
That's good. Blessings, man. For me, I don't do the Christmas, you know, but you know, embrace time with my family and stuff. You know what I mean? But it is a season for everyone to get together, share love, you know, and stuff. Aiden, you were diagnosed at the age of 53 with prostate cancer.
Yeah.
Right? How long ago was this?
That was 9 years ago in November.
9
Just
years.
over 9 years, yeah.
Okay. How did you come by getting your diagnosis?
Yeah, it was completely by chance. I was working, and I was doing a lot of travel with work to lots of exotic places: Brazil, Mexico, Shanghai, North America. And I got put through a very rigorous work medical, you know, to make sure that I was fit, I was well, and I wasn't going to have anything wrong with me in these far off places. And included in that medical, I didn't realise, but was a PSA blood test. And when I went to get my results from all my blood tests, which included cholesterol, you know, your blood pressure, and I saw the doctor at work, he said, "Oh, this PSA level, prostate-specific antigen level in your blood, is unusually high. So you really need to go and see a consultant about that." And I thought nothing of it, because I had no symptoms of any sort. I was very fit. Up until that time, 52 years of age, I'd only ever been missing from work for 2 days in my 20s when I had a bad flu. I was fit. I was a runner. I looked after myself. So I thought nothing of it. I thought, oh, it's just another check, you know, another follow up, because I felt great.
Right. So because I had an interview with Alf. He's in the same circle as well.
Yeah.
And even Derek, they said that there's no symptoms affiliated sometimes with prostate.
Yeah.
And Alf advised that sometimes when you see any signs at all, probably too late.
Yeah, so early stage prostate cancer, so this is the cells in the prostate that are now cancerous. When they are, you know, small and at what they call the early stage, they're not bothering anything. They're not causing any symptoms at all. They're just slowly multiplying and getting larger and larger and larger, and not affecting anything.
So the prostate is a part of us.
Yeah, men have a prostate. They are born with a prostate. It is part of the male reproductive system.
And it gets larger by age.
Yeah, it's unusual part of the body. They say your ears continue to grow as you get older, but your prostate also continues to grow. So in all men, it grows. It just keeps on growing, and normally it's the size of a walnut. But by the time men are the age of about 50, over half of men, it's getting bigger than that. And by the time men are 85, 90% of men will have an enlarged prostate. So it's going from the size of a walnut to sometimes the size of a satsuma. I've even met one man where it's the size of a grapefruit.
What the hell?
So that's, you know, those of you who've had pregnant partners will know that as the baby is developing in the womb, it pushes against the bladder. And they're always wanting to go to the bathroom. So similarly, when you have an enlarged prostate, which isn't prostate cancer, it can cause all sorts of urinary issues. So a need to go to the toilet frequently. Or because as it's getting bigger, it's also squeezing on the urethra, which is the tube that empties the bladder. So it can cause, a bit like putting your foot on a hose pipe, it can cause flow
So
issues.
so it the issues.
Blocks the flow, yeah. So you want to go to the bathroom, you go to the bathroom, but nothing's happening, or you have to force it. So these are symptoms of an enlarged prostate.
Right.
That is quite normal and natural. And King Charles recently had suffered from.
Yeah, I've seen
from
that. I've seen that.
And there's lots of things that can be done for that. So that's quite a normal part of aging.
Okay.
But of course, you know, if a cancer is small within the prostate and it's getting bigger and bigger and bigger, then eventually, you know, it is causing the prostate to get bigger as well.
Right.
And that's why maybe when there are some symptoms associated with that. But when it's really early stage, no, it's not causing any issues at all.
Okay. So you got a test to do. It's like a physical, right?
No, it's a blood test.
It's a blood test.
It's a blood
with
test.
work.
Yeah.
So work just to see if you're fit.
Yes.
Is it called a physical or is just?
Oh, sorry. So the whole thing was a physical, a medical.
A medical.
A medical.
Right.
Yeah.
Right.
A work medical.
Work medical.
Yeah.
Right. And so when they done those check, your PSA level was high.
Yes. Yeah.
Was you have any concern at that moment?
No, because I
Did you know?
I didn't even know what it meant.
Ah.
I didn't know the test was happening because it was one of many tests. And when they said, "Oh, this level is high," I didn't know what high meant.
Right.
But, or even what the possibility of a high PSA level.
So
was.
when they said that to you, what happened after that?
So I immediately had to phone my GP to get an appointment with him, for him to then refer me onto a consultant.
Right.
And so I did that, got referred onto a consultant, and then a consultant said, well, the first thing we're going to do is repeat the blood test, just in case something is causing your PSA level to be high, which can happen. You know, if you've been riding a bicycle, or had a recent ejaculation, or done physical activity, or had a urinary tract infection, that PSA level could be high. Nothing to do with cancer.
Oh, so for instance, then if I had sex and I go to do a PSA test, it's possible that the level goes up.
That's right. Yeah.
Do you know why is that the case?
It's because the prostate has been busy.
Ah.
It's been active.
Fair enough.
And some drugs has also caused the PSA level.
So if you have any medications and stuff
some
like
types, different kinds of medications may impact the PSA level.
Because I've seen this doctor on YouTube, I can't remember her name, but she always recommend men to have irregular ejaculation.
Yes.
Because apparently it helps to lower your risk of prostate cancer.
Very difficult to prove.
Very difficult to prove.
Yeah, but hey, what's wrong with having a regular ejaculation?
Yeah, it helps the mind as well, doesn't it?
but before a PSA blood test, they say you shouldn't ejaculate. I think it's 24 or 48 hours beforehand, because that may cause a spike in your PSA level.
I think it's the same with the when you're going to do a sperm test as well.
Okay.
Yeah. They say you should ejaculate between 72 hours, but less than an hour, 24 hours before.
Okay.
Because you might not get the right reading.
Yeah.
Something like that. So you go to do the test, you get the test, you do a second test.
Yeah.
What was happening in your mind at that time?
I felt fine, so I thought this is just nuisance.
No worries.
Nuisance.
Yeah.
So I had the second test, and that came back high as well. So it wasn't a spike. It wasn't because I was riding my bike or anything like that. He then sent me off for a MRI, which is a scan. It takes quite a while. It takes 40 minutes to have that scan. And he identified from that scan that there was something they could see. The scan shows you the prostate, and he saw something on that scan, or rather, a qualified radiographer saw something on that scan and said, "This needs further investigation." That further investigation was a biopsy. Now, from what I understand, half of men that go on to have a scan because they have a high PSA, it shows nothing.
Right.
And they get given the all clear.
Right.
So that scan is they didn't used to do it 10 years ago, routinely.
Right.
It used to go straight from a high PSA onto a biopsy investigation. And so a lot of men were having an unnecessary biopsy. But things have completely changed. everybody now needs to have that MRI scan after a high level of a PSA is being shown.
So the MRI,
Yeah.
does it done the same thing as the what is the purpose of the MRI?
It's a photograph of your prostate.
So you still have to do the PSA.
Yeah, to begin with, it's the PSA.
Okay.
And that's seeing whether it's worth doing a MRI or
MRI.
not. Because MRIs are expensive, it takes a lot of time.
Right.
So, they don't want to put everyone directly through an MRI.
Okay.
So MRI, which is, shows you, shows the experts a picture of your prostate.
Okay.
And they can see on that, is there anything odd or unusual within the prostate?
So basically on the MRI, if, let's say for instance that they see a increase in size, it would be a cause of concern.
No, because most men there will be an increase in size.
Okay.
What they're looking for is different shadings within the photograph of the prostate.
Oh,
So it's a
okay.
bit like an X-ray, but it's
Okay.
not quite an X-ray. So
Okay.
it's magnetic resonance imaging.
Okay.
So.
So what was the biopsy like for you?
So then onto the biopsy,
Mhm.
and the biopsies have improved since 9 years ago as well.
Mhm.
So the biopsies most unpleasant. They're biopsies where they have to reach in and get tissue
Mhm.
from the affected area. So reaching in to the prostate,
Mhm.
to the areas that they had seen within the MRI scan that were suspicious,
Mhm.
and pull out some of that tissue. So they use hollow needles to do that. So in my case, 12 hollow needles to pull out bits of tissue. And they then send that off to a laboratory to put that under a microscope and look at that and see what's going on with the suspicious areas that the MRI scan has shown. So,
Some people explain the biopsy as unpleasant, as you said.
yeah.
My mom done a biopsy
Mhm.
before, but she done. I think they give her anesthesia.
Yeah, you get lots of. So my biopsy was local anaesthetic.
Yeah.
Some biopsies they're
Anaesthetic,
general
right.
anaesthetic.
Yeah.
Yeah, so that you don't feel the pain.
Okay.
Yeah, you don't feel
Okay.
the pain. Yeah.
So after your biopsy, I think it was after your second biopsy, you had a work schedule to go away.
Yeah, so yeah, I just had the one biopsy, but yeah,
it was one.
So I then, while waiting for the results, I was working all the time, so this biopsy was in the evening, and I went away on a business trip. Yeah.
So you done a PSA,
Yeah.
you done a biopsy,
Yeah.
and you went on to on a work trip.
Yeah.
Wasn't you taking it serious at that time?
There was nothing to take seriously.
Because, as you said, you were healthy. In your head, you were healthy.
There was no diagnosis at this
Okay.
point. There were investigations, but I didn't know what the results were.
Okay.
Yeah.
So, you go further on to say in the post,
Yeah.
in the paper, that your dad passed at 89.
89, yeah.
Your dad had prostate as well.
No, my
No.
dad. I had no family history of prostate
No
cancer.
family history.
No family history.
Oh, okay.
I was 52 years.
Okay.
53 years of
53.
age.
Okay. So, the fact that your dad died at 89, that's a very long age, comparing to you
Yeah.
at 50, 53.
And
At the time.
my mother's still alive at 94.
At 94. So,
Yeah.
clearly you have a long history in
Yeah.
age,
Yeah.
what you call it, mortality.
Yes. Yeah.
So, are you concerned of your mortality, the fact that no, you, before we even get there,
Yeah.
so you didn't get any diagnosis at the time.
Mm-hmm.
So, you went on to the holiday.
Yeah.
When did you get your diagnosis?
So coming back, November Saturday morning, me and my wife met with the consultant with all of the results,
Mm-hmm.
and he said, "I'm sorry to tell you, you have prostate cancer." So that was a Saturday morning.
So your wife was at the consultant?
Yeah. Yeah.
So when he told you that you had prostate cancer,
Yeah.
if I was a fly on the wall,
Yeah.
what would what would I have seen?
Because it had been a slow build,
Mm-hmm.
it wasn't a sudden thing.
Mm-hmm.
I had started to expect the worst,
Oh, okay.
and So, but I also knew I was well,
Right.
you know, so that I felt no issue,
Right.
and so no symptoms
Mhm.
of a cancer. So, you know, that was what my brain was telling me. You're okay.
Right.
There's nothing wrong with you. And so my immediate reaction was, great, this test
Mhm.
had caught it early and now it can be dealt with. By the way, I'm not a medical person, I'm an engineer
Right.
originally. So you know, the engineer brain that I have
Mhm.
said, okay, you've caught it early
Right.
because of something that was found in your blood.
Right.
So it can now be dealt with.
So
So it was problem solving time.
so in your head, it was fine. It was early. Nothing to worry about.
But
Just to get rid of it.
To be honest, I think to some extent there was relief,
Mhm.
you know, that it had been caught early,
Right.
you know, and I'd had this medical at work.
Right.
Thank God.
Right.
I'd had this medical that had found it early and it
Right.
could now be dealt with.
So in reality, was it actually caught early?
No.
No.
So as we left that consultation, I said to the consultant, at least you caught it early.
Mhm.
And I was 52. And he said, I wish I'd seen you a year ago. And so that started the alarm bells ringing. And my diagnosis was, it was a very aggressive prostate cancer. It's what they call a Gleason 9, very aggressive or high risk. So very high risk of it's going to continue to cause problems. It's fast growing.
So are you concerned about your mortality?
What do you mean by concern?
So the fact that you is it a untreatable,
Yeah, so
uncurable?
yeah. So to begin with, they said we are going to try and cure your cancer.
Right.
And so I had surgery, I had my cancer removed, and the whole prostate was removed.
Right.
And then further tests showed we didn't quite get it all. So we're going to give you some radiotherapy and some drug treatment. And then a couple of years later, they're saying it doesn't appear to have gone. They can't see anything. They cannot see it. It is, you know, this is not a large tumour. It's a tumour that is not visible on scans. It is so small. But they can see it in the blood.
Oh.
So what? They eventually start seeing it on the scans. Tiny, you know, millimeters. They start seeing it on the scans, and they say it is now outside your prostate. It had already escaped. It had escaped at such a small level, at a microscopic level, and those microscopic cancer cells had grown over the years. This is 9 years ago. So we are now going to move on to what they call systemic treatment. In other words, drug treatment and chemotherapy treatment to kill this, to try and control the growth of the cancer for as long as possible.
So basically, what does it mean when the cell has moved from the prostate?
So
What does that mean?
it's when a cancer cell has moved outside the prostate, that is now what is called stage 4 prostate
Stage 4.
cancer,
Okay.
or metastatic prostate cancer,
Right.
or even advanced prostate cancer.
Okay.
So it's got 3 different names for it:
Okay.
stage 4, metastatic, or an advanced prostate cancer.
Okay.
And the other one, unfortunately, is uncurable prostate cancer. So it's now uncurable, but it is treatable for many, many years. And I mean, really, many, many years. The men that I know, 9, 10, one man, 14 years, they've been living with uncurable prostate cancer. So and some men, it's not that long. So it really depends on the individual and the individual cancer, because they're all slightly different, and all men are slightly different.
So you are on treatment at the present moment.
Yeah, I am. Yeah.
So based on my research, there's some side effects
Yeah.
to these treatment. What are the treatments you are on at the present moment?
So I'm on 2 treatments at the moment. One is something called androgen deprivation therapy.
Mm-hmm.
So androgen is the generic term for a hormone,
Right.
and a male hormone. The main male hormone is testosterone.
Testosterone. Right.
So deprivation means you're not making testosterone,
Okay.
and treatment or therapy is the T. So ADT, sometimes called hormone therapy,
Mhm.
and that is about stopping your body producing testosterone as much as possible. So why testosterone? It's because the cancer cells need a signal from testosterone to grow.
Mhm.
And if they don't get that signal from testosterone because your body hasn't got any, it doesn't grow.
Oh,
It stays dormant, asleep.
okay.
So there's one type of drug that stops you producing testosterone, and then there's another type of drug that gets in the way of any testosterone that your body does produce and the cell. It's called a signaling inhibitor. So testosterone is a hormone, is a signal,
Mhm.
but if something gets in the way of the signal, so that's a drug called an ARSI, androgen receptor signaling inhibitor. It gets in the way. That again stops the signal being received by the cell and saying grow. So that's the second way. And then the third treatment is chemotherapy, which basically it's a poison
Hormone.
which kills fast-growing cells.
Mm.
So it kills them wherever they are. So in my case, it's killed my hair,
Oh.
it's killed my eyebrows, my eyelashes. It's damaging my nails.
Oh.
So it causes those side effects.
So that's why your nails is looking like that.
That's right. Yeah.
Oh.
Yeah. So I'm having
Whoa.
chemotherapy at the moment.
Okay.
Now these treatments don't last forever.
Mm-hmm.
The cancer is very smart,
Mm-hmm.
and eventually the cancer goes, do you know what? I'm not getting any testosterone to grow. I'm just going to grow anyway. And in some men, that may take many, many years.
Mm-hmm.
And you know, cancer may be in different parts of your body, so it may only be in one part that they say, do you know what? I'm not going to wait for testosterone to tell me to grow. I'm going to mutate and grow anyway.
Okay.
And similarly with chemotherapy, eventually chemotherapy can become ineffective.
Mm-hmm.
The other thing I have to mention is that not everybody can take chemotherapy.
I realize that.
And similarly, surgery, not everybody can take surgery. You know, they may not be fit enough or well enough for that. There may be other issues going on. They may have bad hearts. They may be very overweight, and they can't take it. And so that's why it's so important that no matter what, to always be as fit and as strong
I
as you
was
can.
going to ask you that if you think that contributing to you being a healthy person overall, because you said you was a runner before.
Yeah.
So are you keeping up with your exercise?
Absolutely, go to the gym. Even if I'm having chemo, I'm going to the gym 5 days a week.
Oh.
Yeah, so it's so important, and especially if you are not producing testosterone, because one of the side effects of not producing testosterone is that your muscle may waste
Mm-hmm.
and your bones may get weak, similar to female menopause.
Oh, okay.
So you've really got to hit the gym. You've got to do your weights.
Mhm.
You've got to stay active as far as possible to keep yourself in form and not put on too much weight.
So you mentioned earlier that your wife was with you at the appointment.
Yeah.
What was her reaction like when she heard that you had cancer, prostate cancer?
Shocked. Yeah. Upset. Yeah. So it's the thing they say about prostate cancer. They also say it's a couple's disease.
Right.
Yes, it's physically impacting on the man, but it's also
also
impacting on the couple.
Right.
And yeah, that's so absolutely. So my wife and my daughter are also going through this disease with me.
Yeah. It's always the case because some families actually break apart.
Yeah.
Not that the wife or the husband want to break apart, but
Yeah.
because it affects the mental health as well.
Yeah.
You know, some people decide to, separate because of
Yeah.
the agony and the pain and
Yeah.
stuff. But what are that situation like? How does it affect you and your partner?
To be honest, it's made us stronger.
Right.
It's made our partnership stronger.
Okay.
And you know, all relationships have difficulties. All partnerships have difficulties. And so, you know, in the beginning, some relationships and some partnerships may not be strong enough to withstand a big stressful event, whatever that looks like. And in my case, that big stressful event was diagnosis of prostate cancer. But our relationship was good and strong and got stronger as a result of it.
That's good. That's good. So are you experiencing any of the side effects that comes with the treatments that you're on at the present moment?
Yeah. So you know, with surgery, when they remove your prostate, it depends on how good the surgeon is and where the prostate cancer is. But there may be side effects of sexual dysfunction. So all men without a prostate will no longer be able to have a liquid ejaculation. It's a dry ejaculation. So you orgasm, but nothing comes out.
And that is by removing the prostate?
Yeah, because the job of the prostate is to produce the liquid that the sperm swims in. And so by removing the prostate, there is no link, no way of the sperm to leave the body. So you can't have children.
Oh, I didn't know that part. I think I've seen something where they have some replacement or something like that after removing the prostate, but it still doesn't bring forth any sperm.
No, the plumbing has gone. You know, the tubing that has gone from the testicles, which is where the sperm are made, to the side of the prostate and into the prostate, where it gets mixed with the liquid. So that is all broken. So, you know, any man. So. Men, when they are being diagnosed with prostate cancer and are looking at surgery or radiotherapy for it, they will be counselled and said, look, if you wish to continue to have children after, you need to freeze some sperm now.
Okay, so you can freeze the sperm.
Freeze your sperm, yeah.
So, like for a younger person that's going through a prostate issue, it would advise for them to freeze the sperm.
If that was their decision, yeah.
But would the doctor give them this advice, or would they have to know these things for themselves?
I can't speak for individual doctors.
Okay.
But I mean, Al Pacino recently, in his 80s, recently had children, didn't he?
Al Pacino.
Al Pacino,
really?
Yeah, I think he just had a kid in his 80s.
He's still shooting guns.
Yes. So, you know, it depends on circumstances. You know, my daughter was born when I was 7, and you know, you've got to be strong to bring up a kid, haven't you? Yeah. So, but it's an individual decision, isn't it? When do I want to stop having children? And of course, if you're in a new relationship, a new marriage, or something like that, then your partner may want to continue having children as well.
So it's, as you said, it's a couple thing.
Yeah.
So what other side effects that comes with the treatment plus prostate will be removed?
So some men may have sexual dysfunction because the nerves that are telling you to have an erection are damaged during the surgery.
Okay.
And that may be short-lived and that may come back. But there are lots of things that can be done about that.
Like what?
Like simple medication, like Viagra, those kind of products.
Okay.
And similar type things. Injections can help, do help. And something called a vacuum pump as well.
So you can still have a normal sex life after these things being removed and these treatments. You can still have a normal sex life, but just dry ejaculation.
Yes, yeah, that is absolutely possible. But bearing in mind that as you get older, what is a normal sex life? Because as men get older, they may also suffer from sexual dysfunction because of other issues.
Right. So it don't need the operation or your prostate to be removed for it to be affected.
To have sexual dysfunction.
Right.
Yeah. So it's not an unusual thing as men get older.
I remember, as you said, Al Pacino. He's in his 80s.
Yeah.
and he just have a kid. I can remember because I had a business in Jamaica, a car wash, very successful car wash, and I had a customer. He was in his 82 at the time, and he said his wife couldn't handle him because his sex drive is so high.
Yeah.
You know what I mean? So I think it boils down to how you treat your body at the end of the day as well. It can help. So as I said, exercise is really, really important.
Yeah.
And I think diet plays a lot of importance as well.
It does, yeah.
Right. So so you bring
there is one more side effect, particular to surgery or radiotherapy that do trouble some men, and that's incontinence. Because when they remove the prostate, they may also create a little bit of damage that causes you to leak a little bit of urine.
So is that why some men have their, what's it called, a continent pad?
Yeah, pads. Yeah, or a pad. Yeah. So so some men may need to wear one pad a day, for instance. And that's just to catch the little drips. And then some men, may have more severe issues, but that is treatable as well through something called an artificial sphincter, which dries them up completely.
Dry up the
leakage.
The leakage.
Yeah.
Okay. So because
always something can be done for these side effects.
Okay. Because I've watched a podcast, well, not a podcast, an interview with this guy, and he had his prostate removed.
Yeah.
And he had some operation marks on his tummy.
Yeah.
And he was showing his like a pampas. He was wearing like a pampas, and he was showing the pampas on YouTube.
Yeah.
And I was like, wonder how does that affect his mental health?
Yeah.
Because you're still maybe well enough vibrant. You still maybe well enough going on the street.
Yeah.
You still maybe interacting with people. How does that really affect how do you cope with your mental health when it comes to these things?
But I mean, I carry a spare pad with me.
Oh.
And that's typically, what. But most women carry pads.
Yeah, because looking at this now, it just because when my kids when I was living in Jamaica, and I'm coming home, my daughter would say, buy me a pack of Stay Free or stuff for it, and I used to encourage them to like carry at least one Stay Free in their bag. Yeah. So they would have like a little purse. Yeah. They would put the Stay Free, and it just remind me looking at this, it just remind me of a Stay Free.
Yeah, no flowers on it. So that what these do actually is give you confidence
because it's smart.
But not only that, but if you are leaking, and it is really small amounts. It's not going to come through your underwear and into your trousers because that's going to protect it. So that's so that is not a massive toddler pamper, is it? Nappy. So that's what they say. For small amounts of incontinence.
So why I see that guy with actual pampers then?
Well, he must have more severe incontinence issues. But there are lots of ways of dealing with that. One of them is to improve your pelvic floor strength, which is what women are encouraged to do after they've had a baby.
A baby, right?
And then ultimately, if it's not drying up such that that's all you're using after 12 months, or not at all, because some men I've met have come away from surgery and not needed anything.
Okay.
They're completely dry.
With the pelvic floor exercise, I wouldn't advise men to just wait until they have these operations. Pelvic floor exercise actually help with your libido as well.
Absolutely, yeah.
It helps with your keep that your firmness.
Yes.
As well. So you can incorporate that in your exercise.
Absolutely.
No, before you even get to a 6th stage.
Yeah.
So pelvic floor exercise is really, really important.
Absolutely. For all men. Absolutely.
For all men. Yes, definitely. So you have some models here.
Yeah.
I see that thing, walnut.
Yeah, so that's really just an example of that's the size of a normal prostate.
The
size of a walnut.
Oh.
Yeah, that's the normal prostate.
Okay.
And so when it's getting bigger, unusually bigger, which is an enlarged prostate or BPH, such as King Charles had, it's going to be the size of a satsuma, and then other men it's the size of a grapefruit. So that's the normal size.
Okay.
And so and through the middle of that, as I'll probably show on the model here, through the middle of that, there is the prostate, passes the urethra, which empties the urine out of the bladder through the penis there.
Oh.
Yeah.
Okay. So this is the prostate.
That's the prostate, yeah.
This is where the urinate come from.
Yeah, that's the bladder, yeah.
So and this I'm sure this is where the sperms will come from.
So the sperms are made
from there.
in the testicle.
Oh.
And they come up into the seminal vesicles there.
Yeah.
And then when it's time for an ejaculation, they come out of the storage area there and get mixed with the liquid here and pumped.
So it still passes through the prostate.
Yeah, absolutely. Yeah.
So it's like an engine.
Yeah. It's a muscle. It becomes a muscle to ejaculate, to send it flying through the air. Absolutely. Yeah.
The human body is so fascinating.
Yeah. And there's the pelvic floor, that blue line there.
Yeah.
And so, unusually in men, to stop the urine leaking, there are two sphincters. So men have two, one at the top and one at the bottom. So women only have one sphincter because they don't have a prostate.
Okay.
So that's why they have to have a stronger pelvic floor.
Okay.
So when the prostate is removed, it removes one of the sphincters.
So that's what caused the leakage.
Yeah. So you're relying on the other one and your pelvic floor more than you used to.
Makes sense. Okay.
So yeah.
Makes sense.
So that's what's going on there.
Wow. Yeah. Makes sense.
Yeah.
Very, very, very interesting. So, go back to where I asked you about, the mental health. Does it affect your mental health? How do you cope?
Yeah, I mean, it is what it is.
Right.
And I do what I can, but there are some things that are not in my control.
Right.
And so the things that are not in my control, I don't worry about.
It makes sense. That's a good way to deal with your mental health, isn't it?
Yeah. So it's that simple. Would I rather not be in this situation?
Of course you.
Yeah, but I am in it.
Yeah.
It is what it is. So I'm having to deal with that.
Screening.
Yeah.
Every year, women have the opportunity to do mammogram.
Yeah.
Cervical screening, like pap smear and stuff like that.
Yeah.
I think PSA is a part of screening, but it's not.
It's not. So there is no screening. A screening is where everybody goes through it, and you either get the yes, you've got something, or no, you haven't got something.
Yeah.
So it is only two routes out of a screening: a problem or no problem.
Right.
And the trouble with the PSA test, it isn't that definitive. There are what they call false positives or false negatives.
Okay.
So breast cancer screening, cervical cancer screening, and bowel cancer screening are where everybody gets, if they are eligible, gets invited, and the whole country is covered. But that doesn't exist yet for prostate cancer, because there isn't a single test that will give you a clear indication of whether you've got a problem or you haven't got a problem. So we talked about false positives that may give your PSA level an unusually high amount, but there are some men that have prostate cancer where they doesn't record on the PSA. In other words, they have a normal PSA, but they've still got prostate cancer.
Is there a reason for that?
They don't know. So it's about 10% of men whose prostate cancer does not give off high levels of PSA.
Okay.
So that's why it is problematic and cannot be used as a definitive test for cancer. This is only an indicative test that there's something going wrong with most men's prostate. And what is that problem? that needs further investigations to find out. So the MRI and the biopsy.
So you recently attended a prostate seminar or meeting at the Parliament.
Yeah, the House of Commons. Yeah.
Right.
Yeah.
What was that for?
Yeah. So we know there isn't a good screening available yet, but we do know that we do have PSA testing.
Right.
It's problematic. It gives false positives and false negatives, but it's the best we've got.
Okay.
And we know that some men are more at risk from prostate cancer than others. You already mentioned that the first group is black men.
Right.
So twice at risk is black men. So 1 in 4 black men will get prostate cancer in their lifetime. The other group that's at risk is men with a family history of prostate cancer. So a father, a brother, or an uncle. You are 2 to 3 times more at risk yourself.
So, because I'm already aware that I am high risk because my mom died of breast cancer.
Yeah.
And I've come across a research that men that their mom died of breast cancer are high risk of prostate. Several brothers had prostate cancer. I think she had 2 brothers that passed on prostate cancer.
Yeah.
Cousins. Yeah. So I am at high risk.
Yeah. The third element of risk is age.
Age.
So from the age of 50, you are the guidelines back from 2019 say that if you are starting to fit into the high risk category, so 50, black, family history of prostate cancer, you can go to your GP and request the PSA blood test. So it's problematic because it gives false positives and false negatives, but in a lot of men it will end up with a diagnosis of prostate cancer. So this event at Parliament was showing that, do you know what, there is a financial case, not just a moral case, but a financial case for those who are at high risk, so black men, men with a family history, of being more proactively reached out to and said, hey, come to us and have a PSA blood test. It's not perfect, but it's the best that we've got. And it might show that you have prostate cancer, and it might catch it early, and we might be able to cure you.
So Parliament is looking into some things.
They're reviewing it. They're showing that it makes financial sense. So this was the report that was issued by a charity called Prostate Cancer Research. They did some financial studies that said, do you know what? It is worth bringing in men that are in the high-risk population and putting them through this blood test. Some of them will be all clear, but some of them will be caught early. And it will be much cheaper for us to catch them early, for the NHS to catch them early, than to wait until that prostate develops and becomes stage 4, and to treat them for many years for stage 4 prostate cancer. There was one European study that showed it, to catch prostate cancer early and to treat it early costs about €3,000. But to, over the lifetime cost of treating it, if it is caught late,
triple.
No. €300,000.
That's a lot more compared.
Absolutely. So it's huge difference. So it's saying it's worth, bringing, and catching men earlier and earlier. And in the West Midlands, it's 19% of men that are caught late. And do you remember the BBC journalist Bill Turnbull? His cancer was caught late, but he was treated for 9 years before he passed away. Okay. Chris Hoy has recently been caught late, but he will have many years of life before, it is uncontrollable. Now, in those years that are to come, there may be cures.
Okay.
That may happen.
Hopefully, fingers crossed.
Absolutely.
Not many people know about the PSE test.
Yeah.
But I've seen in the article you explain about the PSE test.
Yeah.
Can you explain to the audience what is the PSA comparing to the PSA comparing to PSE?
Sorry, what?
The PSA.
Yeah.
Comparing to the PSE.
I don't know the PSE one.
I've seen in the article that spoke about the PSE test.
I don't know anything about that one.
Okay.
The main one that's in use at the moment is the PSA, prostate specific antigen.
Okay.
It's a type of protein.
With the PSE, I think you mentioned in that or probably am I quoting it wrong, but you said it was like over £900 for it privately.
Oh, sorry. Yeah, there are new tests that are coming through.
Yeah.
That look at more than just the prostate specific antigen. Right. They really do look at the genetic makeup.
Okay.
And any other things that are in the blood, but they're very, very early days yet. Okay. And this is the trouble with all of these studies. It takes a very, very long time to find out whether they work or not.
Okay.
And the PSA blood test, you have to have that every year.
Yeah. And this is one of the things, because I've done one last year. It was over a year now.
Yeah.
And it's surprising me that I have to be calling the GP to request the next one. I thought they would have called me by now, but unfortunately they haven't.
And that's what we want to. That's why we're at the Houses of Parliament, to say, hey, it shouldn't be about you and me phoning up the GP. It should be about there being a process in place for us to be called in and say, we know that you're at risk, you're a black man, we know you're at risk, you have a family history of prostate cancer. We want to do a test on you. It's not perfect, but it's the best that we've got.
Yeah, at least you know something, you know what I mean?
Yeah.
Right. Yeah. Do you have any advice that you would want to give to men?
Yeah, so you know, the advice I give to my brother, he's a year older than me, and I did it straight away after I was diagnosed. I said, you're now in this high risk group.
All right.
You know, you've got a family history of prostate cancer, that's me. So go to your GP every year and get a PSA blood test. But also make a note of the number, because as you get older and your prostate gets bigger, that number that they say there's no problem moves a little bit. It goes from a level of 3 to 4 to 5 to 6 over many years.
So it's important to know your number.
Know your number, because, you know, if at the moment you are 0.5 and within a year it goes to 2.9, it may be below 3, but it has moved so fast in a short period of time. So it's about the dynamics of it as much as the absolute level of it. So how fast is it moving? So know your numbers.
We often spoke about the myth about surrounding prostate cancer. We talk about the myth where fingers inserted in the bum.
Yeah.
We talk about you know, the myth where I can't remember some of the myth that we spoke about on this podcast, but what are some of the myths that you would like to?
Yeah, so a long time ago, a GP, the way they would test for prostate problems would be what they call a digital rectal examination. Some people think that's about computers.
Right.
It's not.
It's not.
The digit is the finger. So this is the
it's one.
it's the finger, the doctor's finger, examining the prostate. You know, by pushing their finger up the back passage and feeling around the prostate. Now, first of all, you can't feel the whole prostate. You can only feel a little bit of it. And you need to know what you're feeling for. So you need a calibrated finger.
Okay.
So not all doctors have got that level of expertise. But there was a big study that was done by the NHS last year called Getting It Right First Time, GIRFT, about the diagnosis of prostate cancer. And they said, do you know what? The first test needs to be a PSA blood test. There is no need for GPs to do a digital rectal examination. And they went even further than that. And they said, you know, if someone is presenting with a high level of prostate-specific antigen to the consultant, the consultant shouldn't bother with a digital rectal examination. Now, the consultant will have a calibrated finger. They will have done this test many times, whereas the GP may not. And they're saying, don't bother with the digital rectal examination. Go straight to the MRI. And the MRI will show you, give you the evidence, the physical, the evidence, the picture of the prostate, and show you if there's anything specific there. So there is no need for a digital rectal examination. And so you can refuse a digital rectal examination. I know one man who was diagnosed with prostate cancer, and he had never had a digital rectal examination. And that was because he'd had a colonoscopy, which is basically means that he then has to have a bag for his feces.
Okay.
So he doesn't have a working back passage. It's been sewn up. And so, you know, it's a very real example of where you don't need it.
Okay.
So now some men will actually be concerned and say, well, I've heard that some men may have a low PSA and still have prostate cancer. So they may still wish for a digital rectal examination, because although it's not perfect and a PSA blood test is better for a very small number of men, they may want to have a digital rectal examination just to prove.
It's good to get these things.
But at the end of the day, women have much more invasive investigations than men. So it's, if it's going to save your life, but it's not necessary, and they're eliminating it from the diagnostic pathway.
Okay. Aiden, you have a support group as well, right?
Yeah.
And you coach people that's going through their diagnosis and stuff. Can you tell us a little bit about that? How does it work, and how people can get in contact with you?
Yeah, thanks. So I run two support groups. One is the Solihull Prostate Cancer Support Group. So we meet on the last Tuesday of every month.
Right.
In Solihull, face-to-face meeting. We have speakers there, and most importantly, you get to meet other men who've been diagnosed, and you can talk to them. And then I also run an online group for men with advanced prostate cancer.
Okay.
It's called Living Well with Advanced Prostate Cancer. So it's about managing all those side effects, which may go on for many, many years as you're having treatment for advanced prostate cancer. But when I first started looking after the Solihull group about 8 years ago, we were getting a lot of men that were coming for the first time. There was one man that was diagnosed that very day, and he came to the group, and he said, I've been given this choice of treatments. One option is to actually do nothing, called active surveillance. And it's not do nothing. It means that you regularly have a test and you regularly have a scan because you have a very slow growing cancer. And so let's just monitor it and have many years of active sex and dryness, and having children, and we will monitor it. So don't have any radical treatment. Then another option is surgery, and then another option is radiotherapy. And so men like myself, engineers who know nothing about these kind of things, say, well, how am I supposed to make that decision? And so we put together training for men to act as buddies, to work with them and say, okay, well, first of all, do you understand your diagnosis, which is complicated itself? And secondly, have they explained to you what the options are for treatment? And do you understand what all the different side effects are of that? And then the next thing is, how are you going to make this choice? And so talk through, you're not buying a car, you're not buying a fridge, you're not choosing someone to do your drive or something like that. How are you going to make this decision, this choice? And there's a lot of work has been done on regret in cancer decisions.
Right.
And so there's 3 types of regret. One is you regret the decision that you make. So years further down, you say, I had surgery, I chose surgery, but I wish I'd gone for radiotherapy. So that's called decision regret.
Okay.
And that's not good for your mental health. A second regret is outcome regret. I regret that I chose surgery, and I can, no longer have spontaneous erections. I have to do something to get an erection. So I regret that. So it's the outcome regret. Or, I regret I chose that and the cancer has come back, which it sometimes does. And then the third regret is process regret. I regret that I took a hasty decision. I didn't think it through. I didn't speak to other men who had been diagnosed. I didn't understand what the possible side effects are. And so what we work with men who have been newly diagnosed that have this treatment decision, we work with them to help them figure out how to make the decision. We do not make it for them.
Right.
We make sure that they've got all of the information that's available to them. And they deep down within themselves, figure out and understand, what kind of, what decision they want to make. So, and it will be a different decision for someone who's a self-employed plumber, for instance, to someone who's, going to get paid time off work to have 7 weeks off work to have surgery and recover from it.
Right.
Whereas a self-employed plumber may need to work every day. And I worked every day through 30 sessions of radiotherapy. Ooh. So you can work through your treatments.
That's a lot. That's a lot.
So it depends on you as an individual. And it also, you've got to bring your partner into it as well. Okay. And say, how are we going to make this decision between us? Okay. And really understand what the potential side effects are, and what will lead to that. So we train men up to work on a one-to-one basis with other men and other couples to support them with their treatment decision making.
So guys, you hear that there are support out here that offer support for men that's going through prostate cancer. So please do yourself and your family a favor and get tested, please.
Just one more thing, Brian. If there's anyone watching the podcast that wants to be trained, that's had prostate cancer, that wants to be trained to be able to provide one-to-one support, it's a 2-day training, but within their community, within their church, that people may know they've had prostate cancer, and they may automatically be going to them and looking for advice. We men are not clinicians. We cannot give advice, but we can show people the good places to look for advice. To help them prepare for their clinical consultations and to help them figure out how are they going to make that treatment decision and be alongside them as well. In some cases, to go with them to consultations.
So do the person has to have prostate or that experience?
It's best if they have that lived experience, because they then truly know what it's like to be diagnosed.
Because I would like to have the training to incorporate it on my podcast. Because when I said this podcast is about cancer, my mom passed of breast cancer, but it's a whole health holistic kind of podcast, so having the knowledge, it would be good. So that's why I really ask. So do you have any other takeaway message that you would like to leave with the audience?
The one thing that the one thing that I always think, and that's choose life.
Choose life. Life is the greatest, man.
And these things are sent along to help you live longer. Whether it's a PSA blood test or whether it's a treatment, and choose life. Life may have difficulties, like having to carry a spare pad around and doing a little bit of leakages, not being able to get a good erection spontaneously. But as I heard one man say, you cannot get an erection in a coffin. So choose life, and live that life.
Definitely. Aiden, we have a closing tradition also on this podcast, where we ask the guests to leave an encouraging word for the next guest coming up, not knowing who that guest would be. And the guest that leave that encouraging words for you is correct. She's a nurse from the US, and she said, life, like the movies, has its twists and turns, some harder than others. And always remember that you are reliance and courage in the face of health and struggling are nothing short of erratic. Just remember, every great story has its moments of triumph, and yours are still unfolding. You are stronger than you know, and there are people here cheering you on every step of the way. A beautiful encouragement that she left for you.
Thank you,
Aiden. And I'm going to ask you to leave your encouraging word for the next guest coming. Thank you guys for joining yet another podcast. If you like what I am doing, please consider to give us a subscription, because your subscription means a lot to the growth of this channel. And leave a comment in the comment section and let us know what you think about Aiden's story and how you can incorporate it in yours. Take the advice that he has given and please pass it on to someone that they can also learn. Until next time, stay safe, stay blessed, and eat healthy.